All right, everyone. I'm going to get started and I'm going to ignore the waiting room for a second so I don't get distracted. But good afternoon, everyone. My name is Allie Dowds and I use she, her pronouns. I am the consultant for special populations here at MBLC. Um, Many thanks for attending today's panel titled Building Sustainable Support Through Funding. This session is part of MBLC's 12-month series, Core Connections, Building Community Supports and Allyship at Your Library. And I'll share a link to that webpage in just a moment. But today's session is going to focus on how to leverage grants, funding opportunities, and strategic partnerships to enhance services for special populations. It's a bit of an in-house collaboration today as MBLC's own Lindsay Forbes will facilitate the presentation and discussion. Lindsay is our project manager and grant specialist overseeing MBLC's direct grants program. Many of you probably have worked with her at some point in the past. And she also is our liaison to IMLS whenever questions, new developments, or just a complete depletion of funds arise. And then joining us later in the conversation is Antonia Stevens. Antonia is the director of the Hyannis Public Library and will provide field expertise and share her experience pursuing and employing grant funds from private donors and federal and local resources to enhance library services and space for patrons with strong social service needs. Antonia is really a great example of getting creative, working your networks, and not giving up. Today's session will be recorded and shared with all registrants. A quick reminder that as a state agency, we are not allowed to have other recordings such as Otter AI. So if you have a recording, please disable it at this time. Q&A will follow with the two presenters, but please feel free to use the chat to submit questions or comments throughout. I also encourage anyone who would like to introduce themselves and their library to please do so in the chat, just so we kind of see where everyone is coming from. And with that, let me welcome Lindsay.
Okay. I have unmuted myself and I just want to make sure that you can hear me. Right, Allie?
Yes,
Okay.
you are
Okay.
sounding great.
Okay. That's always the exciting part of Zoom is making sure that you're actually not just rambling on and people can hear you. All right. So we're going to dive right in to this. So when should you pursue grant funding? When does it make sense and when does it not? There can often be this idea that if you're in need of funding, just go get a grant, just go get one. Grants are a tool, and they need to be the right tool for your project in order to work. They are not a magic pile of free money. They are one type of funding stream. One key part of identifying appropriate funding sources is to consider the administrative burden of the grant. Grants involve effort, both at the application or pre-award stage and project or post-award stage. The amount of effort and requirements vary. Those don't necessarily scale directly with the amount of funding. The amount of effort is going to vary based on what the grantor requires in terms of the application process and reporting requirements, and what you will need to do to carry out the project activities you propose to do in your grant. Look very closely at what a grant requires and be realistic about whether or not you are in a position to take that on. We're going to go over what you should be looking at. Grant opportunities should clearly list who's eligible to apply, what sorts of projects they fund, how much funding is available, or the number of projects funded per cycle. This gives you a sense of how competitive the process is, the amount of funding a project could receive, any match requirements, key dates for the grant, application or pre-application requirements. Seeing if your organization can apply and if they'll fund what you want to do is an important first step, but you don't want to stop there. What does the application look like? Does the timeline for submitting a viable application fit in with everything else you have going on right now? Are you going to be able to write a compelling narrative, find supporting documentation, pull together an accurate budget, get support letters, or any other required components by the deadline? Are there required trainings that you need to go to? And keep in mind that you will very likely need to involve other people and their schedules in this potential work. What you need to do at the pre-award stage is going to vary a lot, but save yourself some time by stopping to consider how much time you have at the moment. Maybe it doesn't work for this funding cycle, but it might in a future one, particularly with some planning ahead. Or maybe what this funder is requiring at the pre-award stage will never work for you. And while it's disappointing that they can't be an option for you, you can put your time and energy into other viable avenues. Let's say the pre-award portions work for you. Amazing. Let's look at the post-award portions. You need to consider reporting and monitoring requirements. What and how much do you need to report, both project activities and financial information? Any additional documentation that needs to be sent? What sort of monitoring is happening? Are they just regular updates via email? Are there required meetings with the funder? What is the format of those? Are they in person or they're virtual? Who would need to attend? And again, people. Who else would need to be involved in the post-award part of the grant? Are there other departments that need to be included in this? And those might be some people who are not in the library. You want to look at your financial considerations. How are you getting the funding? Is it coming to you all at the start of the grant? If so, all of it or just a portion? Is this a reimbursement grant? If it's a reimbursement, how long do you need to wait between incurring expenses, submitting them, having them approved, and receiving funding? If you need to, can you cover those financial costs until you're reimbursed? And for how long? What else would that affect in your organization or put at risk? Does the grant require you to meet certain thresholds or metrics in order to receive funding? What happens if you don't? Have you incurred financial costs that you will now have to pay out of your own funding? What if a cost is ineligible? Organizations are going to have expenses that they will cover and ones that they won't. You want to be very diligent in knowing what qualifies as an eligible grant expense. If something comes up that the grant cannot cover, can you pay for it or recoup your costs from other funds you have? Audit requirements. Will this grant require an audit, or more likely be part of a larger pool of grant funding that will require an audit? For those of you in university and municipal settings, it's typically not the library that receives what the library receives in grants, but what the university or municipality does. Where is the funding coming from? Is the funding originating at the grantor's organization, or is it part of a larger grant from another organization? For instance, MBLC receives funding from the Institute of Museum and Library Services, IMLS, via the Library Services and Technology Act, LSTA. We use a portion of this funding to award grants to libraries, and this process, called subgranting, is common. Be aware of what other organizations are linked to your grant funding and how that impacts aspects of the grant, such as the reimbursement process. If the organization you get your funding from doesn't get it from the original source, you're likely going to be stuck with the cost you've incurred. Terms and conditions. When you're awarded a grant, you're probably going to sign some sort of paperwork. Again, this is going to vary by the grantor, but these will be legal terms and conditions you need to abide by. What exactly are you agreeing to? What processes need to be in place for you to be able to do what you're agreeing to do for this grant? Something as simple as, how long do you need to maintain records? Does that work with what you currently do, or is there something you or someone else needs to do to make sure that actually happens? A lot of times what you're going to be agreeing to will be perfectly reasonable, but you want to make sure that it's actually happening. If your typical work processes and policies cover that, great. But if they don't, how are you going to make sure that they do? The time you spend on a grant isn't just carrying out the actual project and its activities. There is administrative and compliance work, and you want to have a clear idea about what that is, the scope of it, and who will need to be a part of it before you undertake the grant. You also want to consider your organization's current priorities and bandwidth. Consider the following questions when you're looking at grant funding. Why are we doing this? Who is this for? Is this the right time for this? Sometimes organizations will have a goal of obtaining a certain amount of grants per year. I do not recommend that approach. Trying to achieve that metric moves you away from considering the best funding option for the work you want to do. Instead, you will likely find yourself pursuing grant funding for the sake of meeting that goal versus being more thoughtful about what makes sense for the work. Receiving a grant is a wonderful achievement worth celebrating and noting, but it shouldn't be a goal in and of itself. Stay true to what you need to do, not what the grant will let you do. While you might make some small adjustments about what you are including in a grant proposal, you shouldn't be creating or overhauling a project to match what this organization will fund. Your North Star needs to be the community or group you are serving, what need has been identified, and what you can do as an organization to address that. Do not follow the money, follow your community. I want to cover a way for you to think about how to map out aspects of project work and resource allocation to help determine when it could benefit from grant funding. Always start with and come back to the big picture pieces. What's the mission of your organization? What long-term goals and objectives do you have? How do those line up with your mission? What does your community want to see happen? What needs have been identified? What assets have been identified? I bring that up because often we can focus on what's wrong and what needs to be fixed, but keep in mind that work can also include amplifying and multiplying good. Once we've reached this point, here's where you can start to map something out. You're looking for a particular change. Think about what sort of evidence is going to indicate you're achieving or have achieved the change you're after. What I have outlined is kind of a modified version of a logic model. So we've got our inputs, we've got our activities, outputs, and outcomes. So inputs are resources you need to make this thing happen. So you would include anything used to create, produce, or develop the program or service. Funding is usually going to go here. That may or may not be grant funding, but you want to consider other resources as well, staff time, space, and so on. Being able to put numbers, even estimates or ranges will be really helpful. Inputs give you an idea of what you need to make this happen. What do you already have and where are the gaps? Activities are what you're planning to do. This can be programs, content, space development, and so on. Outputs, this is where you would list products from your activities, so attendance at programs, number of items digitized. If you're trying to figure out the difference between activities and outputs, it is what you plan versus what the result is. You can plan the resources and activities. That is what you have control over going into this. This is the thing we are going to do. You cannot guarantee outputs. For example, you're going to offer a home delivery service for homebound patrons. That is the activity. Your outputs would be the number of deliveries and individual participants. That is going to be an educated guess. You can give reasonable targets, and your overall plan should give confidence in hitting those targeted outputs, but ultimately you can't control outputs in the same way you can activities. So outcomes. You can have short, medium, or long-term outcomes, include what works for you, but it should help you keep the focus on the work you want to do as an organization, such as addressing an identified need. This is giving you measures of progress around the change you want to see in the community. So I want to differentiate between outputs and outcomes. Outcomes are user changes. How is this affecting the group this is serving? These are going to come from the user. It can be someone feeling more confident in their language abilities or reporting having passed the TOEFL exam as a result of your service. It could be someone stating they learned something at your job training program or reporting that they are now employed as a result of your program. It comes from the audience being served. This is going to go back to those goals and objectives that are about serving your community and what change the community wants to see. Outputs tend to be like bean county numbers, so number of programs, number of attendees, circulation figures. They're internal service measurements. Those are helpful, but it's important if you're using them as a measure that you aren't using them to tell you something it's not actually measuring. And here's what I mean by that. Don't confuse popularity or big numbers with community change or impact. These types of numbers are often an easy data point to collect and to communicate, but the number of programs, attendance, or circulation aren't actually linked to creating actual change in the audience being served. That comes from what people are reporting as changing in them or their lives. Keeping the focus on outcomes helps you plan the kind of work that is creating the kind of change you want to see and keeps the focus on the community and what they are getting from it. It can be very common when serving vulnerable populations that you don't get big numbers, but that's not indicative of the value or impact the work is having on those populations. So why bother with outputs? Outputs are valuable. You get a sense of the amount of work you are going to be doing. Is that realistic? You can get a sense of how an adjustment in the resources, more or less money, more or less staff, will impact how much work or service you can offer. This is helpful for planning. Documenting both planned and what actually happened with a project will help you with future plans, particularly if you're wildly off. Outputs are also helpful when you are seeking funding and may need to adjust your level of inputs and resources. Also, some funders do care about outputs. They may require minimum service numbers. They may want a sense of ROI, return on investment. Outputs are about how much we do, while outcomes are about the good we do. Both are important to use for the work we do, but just make sure you're using them to measure what they're actually measure. Putting all these components down on paper can help you see what you would need to do to make the work happen. If you have a plan, you have something to refer to when potential grant funding comes up or when you go to look for funding. It gives you a workable model for adjusting depending on the changing circumstances or opportunities. It can keep you from the creep of adjusting to fit a grant versus staying true to the work. If you start changing activities, is that still going to address the changes you're looking for as outcomes? Or are you trying to fit what the grant will let you do? Seeing what you need to make the work happen is valuable to know because it's going to impact other work at your organization. Committing resources in one spot likely means they are reduced somewhere else. Funding, grant or otherwise, is likely not going to cover all your inputs, your staff time, your space. You also want to consider ongoing inputs versus temporary ones. Perhaps you need funding to create a new space, and that's a big one-time cost. Are you still going to need staffing after the space is built? And what does that look like? What about resources in that space? How does that space impact cleaning and utility costs? Grants usually ask about sustainability after their funding is done. Be sure you've considered that and have a plan in place. If you're going to undertake the work, you want to make sure it's something that can be maintained to the level it should. There are many ways we can allocate our resources, but there isn't going to be enough for everything. You want to ask yourself, what is the tipping point for committing resources towards this project? How much does the project require? How much can you scale it back? Does it need to scale up? What is this addressing in your community? How high of a need is it? Laying out all of those components can help you make decisions about what to do or not do. You need to consider resource allocation when figuring out how to best serve your community. Have you reached a point where that infusion of money as a resource makes sense? With any project, you need to do your due diligence and have a clear idea of how funds will be used in the project, how the project still works after the funding is gone, and have ways to measure the success of the project that indicate how it is serving your community. Doing the background work, planning, and asking yourself key questions before you commit is going to help you make an informed decision about whether grant funding is the right tool for this project and when.
Lindsay, can I interject?
Yeah.
Okay. So in that last slide, when you talk about creep, I know you and we've talked about this when,
Mhm.
especially when we're talking about special populations and you're looking at projects and you're looking at grants. Can you maybe talk a little bit about when libraries are trying to support or address a need in their community, especially along the social services lines, but making sure you stay within the realms of the role that the library should have, and you're not just like filling a gap that exists there because nobody else is doing it.
Yeah. Um, Sometimes I think it's going to come down to like what is the actual like size of your library because sometimes different libraries of different sizes can fill different roles. Sometimes it is just a matter of like we don't have the staff to do that. I think it comes down to going back. I know it's like go back to your mission, go back to this. Um, I think it kind of comes down to a lot of we always want to help people and kind of fill that role and fill that gap. I think when you start thinking about is this a like how long is the gap that you're trying to fill? Is this kind of a temporary thing where there's an endpoint to it? I think with a lot of the work that I know you do, it's not. It's going to be an ongoing piece to that. So I think it becomes there are two ways to look at it where it's okay, if we're going to do this thing and we're going to put resources here, what aren't we doing? Because you're usually not getting more permanent support resources for that. It's also kind of an idea of like, is this a role for the library to fill? Can we pay people at the level? Are we going to be able to hire someone who has that background? I think I might get into like a little bit later, and I don't know if I'm exactly answering your question because it always comes down to, well, it depends. And what specifically are you talking about? I think sometimes it's asking harder questions and sometimes realizing that a lot of times our role goes back to like, we're a resource center and we don't have to create the resource ourselves, but kind of doing a lot of like community outreach and figuring out maybe here's the role we can play or like we know that this is a need in our community, but like there's no way that we can meet it to the level that we need to meet it. I don't know if that is kind of getting at what you're looking for.
Yeah, it is. And I think it's like a great discussion question, maybe that will come up later in Q&A too. But I know
Yeah,
this often comes up in grants that I oversee where it's like, should the library be taking this on? And then that
yeah,
feeds into what you were talking about too, with like allocation of resources and sustainability.
yeah.
Because, yeah, yeah.
I think we could have a whole and another discussion about the absence of a social safety net and all that is left are the police and the library and kind of like, well, where are we going with this? But that's a whole nother discussion, I think.
Yeah. Thank you.
Okay. Yeah. All right. So we're going to actually get into aligning project goals with your target audience. So, at what point did you determine the various parts of your project? When was the target audience involved? And how much were they involved? The best way to align your project goals with the target audience is to have them be involved at the at it from the start. And the start is before you've decided on a project, before you've identified the need. It's having it's having the community you serve play an integral and ongoing part of determining your priorities and objectives. What is it that they want to see in their community? What changes are they hoping for? What good do they want to see multiplied? And I want to emphasize the ongoing part. It's not simply doing some work when strategic planning comes up every 3 to 5 years, trying to get that input, and then doing everything else internally with minimal involvement from the community until the next strategic plan. It is consistently co-creating with the community to determine what type of change they want to see. It is consistently collaborating with the community to determine a solution to identify needs. If you're able to do this, your project goals will line up with the community because you have determined and developed them with the community. You are doing something at them. You are not doing something at them, but with them. There are a lot of challenges to this type of work and approach. You need to have a good working relationship with the community, the type of relationship where you both feel comfortable sharing honest feedback. You can both be transparent about constraints and challenges. You are able to have conversations about something difficult. A good working relationship isn't always about saying yes and making people happy. It is about being in a place where you can be genuine and honest with each other, one where you're able to work through challenges and disagreements together. A good relationship with your community is going to be one where it changes the way you think about library work, one where you are committed to the relationship regardless of their library usage. Relationship work does not get the credit for the labor it takes, both to build and maintain. It is a tremendous amount of work, but be careful not to ignore it in the face of other demands on your attention, as it is critical to building the type of work that best serves the community. There are other challenges with this type of work. Staff can wonder what role they are playing. Doesn't their expertise matter? If we leave everything up to the community, aren't we deprofessionalizing our work and putting the library itself at risk? Aren't we asking the community to do unpaid labor by needing them to be involved so much? Do they even have time? Are they even interested? It's important for everyone involved to bring their perspectives and their gifts and talents to the table. It's going to be a work in progress to find the balance between the good of a community-centered approach and the challenges of one's. It requires being mindful of when the labor shift is burdensome and when it just seems like it would be easier to do it yourself. It is about being very clear on what role the library can and should have with their community. It will look different at different libraries and with different communities and even subset of those communities within the same broader place. So where do you start?
Lindsay, I'm going to interrupt again. I'm
Yeah.
so
No,
sorry.
that's fine.
You're bringing up topics and points that are so
Yeah.
relevant, and I don't want to lose the thread a bit.
Yeah.
This really is actually just to give a shout out to a library. I was in a meeting with them this morning, and it's the Berkshire F&EM in Pittsfield, and they're developing a project to support community members who are reentering their communities, so people who are just as impacted and returning to their communities. And there's so much that they're kind of pulling from, and they're trying to figure out like what actually would be the best type of project. And so before they even like develop this grant, they're going out there and they're doing focus groups. And it was just like really refreshing to hear this from this library that's like collecting tons of data. So they've done multiple focus groups. They've met with their community partner who supports people who are in reentry, and it's all this data to drive what Lindsay's talked about with like identifying like what is the actual need. Because oftentimes you'll see libraries, we feel like, oh, well, we can identify that need, but it's really important to, especially with these vulnerable populations, to not think or decide for them, but to actually have their opinions. I stress this a lot, even when you're creating policies or procedures that might have a great impact on vulnerable populations. And it's the same with grants. You should have their input. Focus groups is a great way to do it. Anyways, I just wanted to add that anecdote and give a shout out to Pittsfield because they're just doing some pretty awesome work. So
Yeah. No, and that's good. And that's exactly like the type of work. And it's really hard work to do and to put that into your process. And I hope that comes through with a lot of the things I'm going to talk about, where I can tell you best practices and this is kind of how you should do it. I try and emphasize like it's really, really hard to do this. It takes a lot of time, and it's not time that everyone involved in the process, particularly sometimes when you go higher up, can see as valuable because, like, well, please give me a number to quantify why this is valuable. You're just like chatting with people, and what are you getting out of it? And what you're getting out of it is kind of like what the Berkshire Athenaeum is getting out of it, where it's like you're getting something where you are listening to people, they feel heard, and it's if something is for them, they need to be part of it, and kind of taking that time with it. So I'm glad that you're giving like a current real life example with it. Okay, so relationship building, that's what we're talking about. So what does your relationships look like now? Being honest and aware about the type of engagement and relationship you have with the group is key. Levels of engagement vary. It is perfectly fine and appropriate for some relationships and interactions to be transactional or informational, but if all your interactions are transactional and informational, particularly with vulnerable or marginalized populations and individuals, that's not going to help build and sustain community-driven services. The community needs to be a meaningful part of the work. Figuring out where you are on that spectrum with the community is an important first step. When you identify the gaps in your relationship, you can start to look for potential solutions with the community. What are some small ways you can start to build in more ongoing co-creation or collaboration into the work you do? Is there a need you haven't started to address? How can you meaningfully involve those affected in the process so you are all working together to figure out how to address this need? How do you start building this approach and way of thinking into your work so it becomes an automatic part of the process? Your project work doesn't need to come to a standstill, but you should be looking at ways to improve it through developing and strengthening relationships. It does not need to be an all or nothing approach. Small steps are still steps. Relationships are a lot of work, and it's difficult work. It's also work that is hard to quantify, and oftentimes that can be how we're supposed to show our value in order to justify how we spend our time. But commitment to meaningful community-driven work that centers the community requires that relationship work. Let's talk about meaningful collaborations with community organizations. There are a lot of benefits to collaborating with other organizations and individuals. Something you may not be able to do on your own is manageable when you work with others. You're sharing workloads, you're combining resources, you can fill in the gaps for each other. You can do more together than you would alone. You can build and strengthen your connections with the community and individuals in it. How do you get there? Now, you're going to have plenty of organizations where the relationship is more transactional. They use a space in the library. You promote your resources through your newsletters. Those are fine. You should have those. That's not what I'm talking about when I'm talking about a meaningful collaboration. A meaningful collaboration is going to be one where those involved are working towards a common goal that is a priority for their organization or them as an individual. They can happen organically over time, or perhaps a project or opportunity brings you together. Consider the following. What is their mission or purpose? What type of work are they doing? How does that intersect with yours? In what ways? What populations do they serve? How does that intersect with yours? In what ways? What is your motivation for working with each other? In what ways are you thinking of collaborating? The answer to those questions are going to indicate the types of collaborations that are likely to be the ones that have the potential to be meaningful ones. Similar commitments or overlapping areas of service and populations offer a lot of potential. Be mindful of the potential of a partnership versus the reality of it. What can look ideal on paper may not work out. Be wary of partnering because it looks good or impressive. You want to consider each other's capacity for commitment and cooperation. Do you both have time for the type of collaboration you're envisioning? If you scale back expectations, will that still work for both of you in terms of being worth your time? Do you have compatible approaches to how you manage the work? And I want to put in a quick note. Compatible does not mean the same. Don't limit yourself so you're always working with organizations and people exactly like yourself. Do either of your organizations have processes or requirements that could impact you working together or make it challenging? You want to take the time to listen to each other, ask questions, and gain perspectives to help see where you're both at, and is this something you can both work with? Some of what I'm bringing up might not be immediately apparent when you start these discussions. I'm going to come back to the importance of relationship building that I discussed earlier. Meaningful collaborations are going to be built on and sustained by having a good working relationship. You can have difficult conversations and be honest with each other. You can be transparent with one another about challenges and limitations. You are going to have disagreements. Can you work through them with each other? It's not just enough to see the overlap and where you can work together, but if you're able to work together, is this an organization or individual that you can and want to spend time building and maintaining a relationship with? Ideally, you can start with something small and use that as a learning experience with one another. If you are thinking of committing to a project, get yourself an MOU, a Memorandum of Understanding. For some, this might feel overly formal or feel like you don't trust this organization or person, particularly if you've interacted with them a lot in the past. But it is in everyone's best interest. Documenting what you want to do together and committing to that clearly lays out expectations. It gives a sense of workload and who is responsible for what. It helps clear up misunderstandings and miscommunications. You want to be specific. How are you dividing up the work? If one of you is going to take the lead on community outreach, what exactly does that mean to you? And can you quantify it? MOUs can be very helpful for the likely situation when staffing changes at an organization. And you can always come back and revisit as needed, but an MOU is going to be a great communication and planning tool. It helps it helps you define the work that you want to do together looks like and who will be responsible for that. The best collaborations will result in improved outcomes, good stewardship of resources, produce meaningful work, and allow you to develop deeper connections both with your collaborators and your community.
And Lindsay, I'm gonna just keep on interrupting you.
Yeah, and I'm done with my slideshow, so I'm gonna stop sharing my screen.
So with the MOU,
Mhm.
couple things. So we talk about this a lot in the prison outreach meetup group that I run. But if you're going to do an MOU, don't do it with a actual staff person's name in there. Do it with the position, because to
Yes.
Lindsay's point, like, and oftentimes when you're working with, if you're working with like different social service agencies, or like I was talking about with like the prison realm, there's a lot of staff turnover, staff changes. So if your MOU is with a person, it almost like nulls it. So always do it with the position. So whoever moves into that position keeps it up. And it's really, you're so right that it's so important to have that MOU, because especially when money gets involved,
Mhm.
and say that that funding changes, is no longer there, there's expectations that whether or not you think they're going to happen, expectations get generated when you are funding or supporting an organization in any way. So to have clear expectations and even boundaries laid out in your MOU as to what this relationship and project entails is so important. Um, so MOUs they're extra time, but they're extra value for sure.
And yeah, and I think a part of it is I can't tell, like every year when we do grants, like staff would change. And it's a little bit different when it's in a library, but like when you're dealing with another organization, you're going to have people who are going to come in who aren't going to like understand what's going on there, what else needs to happen. And I think for libraries, we tend to be like, I'll take care of it, I'll do it. And no partnership is going to be 50-50, but like we just
Mhm.
creep to the thing where it's like we're doing like 90% of the work and somehow it's a partnership. So but I think the point about like, yeah, you want to make it the organization. But I've been talking a lot, so I'm going to stop.
Yeah, and before I switch to Antonia, I just put in the chat here if people didn't see it. When Lindsay was talking about collaborations, I know she was focusing on collaborations with outside organizations, but if libraries ever want to like bundle their projects together, like if you're looking towards a grant and to strengthen that grant, bundling your ideas. I'm actually working with two libraries right now that are doing that. Um, I think that's a great option to get that grant off the ground and to give it maybe more staff power, resources behind it to help again with that sustainability and the deliverables. Anyways, but I will now turn it over. Lindsay, I'm going to hide you so you can take a break. And I'm going to turn it over to Antonia. And let me just add you. As I mentioned in the introduction, talk about somebody who has really hustled to find different sources of funding to really meet the needs of extremely vulnerable at-risk populations who visit and use your library or just are part of your community. So I'm so excited that Antonia, you're here to talk about your experience. Thank you.
You're welcome. Yeah, I have used various sources of grants to cover kind of a wide range of projects. I would say, first of all, coming to Hyannis really opened up a lot of granting opportunities in the sense that there are quite a number of different types of vulnerable populations here, both socioeconomically and, in terms of behavioral health and just wellness in general, and age related. So that really kind of opened the field up for me. And one of the first things that I noticed was who we weren't serving. Um, and that was kind of where I started. Almost, I don't want to say low-hanging fruit, but it was so obvious. And in our case, it was, I got there just during COVID, and I noticed that even though we did have service, we were not reaching any of our Brazilian population, and we have quite a big Brazilian population on the Cape. In fact, we weren't basically hitting any of our immigrant populations because we didn't have staff capacity. So one of the first things that I looked at was COVID related grants from different organizations, and I hit on one from the National Endowment for the Humanities, and I mentioned that I was unable to communicate to a whole segment of my population because we didn't have staff capacity. And I asked for funding to hire Portuguese speaking staff members. And I got that grant. And that immediately opened up because my Portuguese, they were Brazilian women, were able to communicate with that community, not just in library, but they knew the churches where people were, and they knew, they're like, WhatsApp is how we're going to communicate. They don't want to look at Facebook. They're going to WhatsApp. And so I immediately had a communication network. And then that started a whole bunch of other options. I then did an LSTA grant that was focused on, I called it Hyannis Helper Hub. And that was, I chose a population. I wanted to do ESL services for the Brazilian population, but have it be a family setup so the adults could learn, do an English conversation while their children were having a program with the children's librarian, and then the two groups would meet together and take home books to read together. So it was sort of a family engagement program. And then the other half of it was a nutrition program called Nourish Hub. And that was originally to help grandparents raising grandchildren create food together, learn about a healthy fresh vegetable, and make a take-home greens garden. And it was the whole thing was based on having learned from the Brazilian population that was now coming into the library and talking to my staff members and kind of getting familiar and asking them what kind of services you need to, and realizing that there are a lot of the barriers to access. What are the barriers to access? And in this case, it was, something for my kids to be doing. I want to take ESL classes, but the kids are, I can't bring the kids to anywhere, right? So it was sort of, how do we address the other barriers? And both of those plans kind of went awry and ended up having to shift focus a little bit, but they were both successful and they led to other programs. So that kind of building off the grants that you do get and the people that you meet while you're doing that, to network further and find more organizations that want to partner with you. So through the Nourish Hub grant, I was then linked to the Cape Cod Cooperative Extension, and they were really interested in, their food access coordinator was really interested in getting more options for people to access fresh food. And she ended up helping me write a grant to the Cape Cod Foundation for a little fridge. It was based on the Provincetown Library had a crop swap. So, people would bring in vegetables or whatever and then take. But I wanted something that was directly, people didn't have to prepare any of the food, because I have a lot of unhoused folks who are at the library regularly, and I wanted to make sure that if they were getting food, that they could just eat it right out of the fridge. And so we wrote the grant, we got that fridge, and the Cape Cod Cooperative Extension hooked me up with a local food access coordinator from the Family Table Collaborative. And that organization stocks the fridge with what we need. So I don't have to do very much at all. It was sort of getting the stuff in place, linking the people together, and then getting it out there. And then with the Reader Hub, which was the ESL thing, we then ended up starting our own ESL classes because we had enough people who were interested in it that it was worth the, in terms of programming dollars to put money into that. Then, so that was like a combination of, state funding, then moving on to local foundations. And that the funding from the Cape Cod Foundation actually came because through their donor advised funds. So they matched that request with a specific donor because they asked me about it and they knew their donors well enough. So getting in, really having conversations with, if there's community foundations or smaller foundations around you, and talking one-on-one with their grants coordinators to say, these are my ideas. Do you know if there's any specific members of your funding community that have an interest in this? So it wasn't just like a broad grant. It was very targeted, this one. Then another thing that I've been doing, as some of you who are here know, we are in the middle of a capital campaign to rebuild the newest wing of our library, which is falling apart. And I wanted to make sure that the facility functioned much better for the community that I have. So I wanted to make sure that we had, visible, easy, accessible bathrooms right at the front so that people who are just coming for the bathrooms don't have to go downstairs. I wanted to make sure that I had a shower facility in one of my bathrooms, just in case we could use that for any number of reasons. Somebody needs a shower, somebody who rides in from work wants to get sweaty, your kid gets into the glitter, they need it, just any kind of way. And selling that to the community was important. It's like everybody said to me, oh, you're just putting in a shower for homeless people. And I'm like, no, it can be used for all sorts of things. What if we want to do a fundraiser where we let people wash their dogs? So finding multiple reasons for programs that will definitely benefit the more vulnerable people in your population. And there are other parts of this build that are designed to be really useful to a community that in need. So we have a teaching kitchen, which we can, teach classes, cooking classes, but we could also use it because we'll have a generator in case we have to do food for people for some, and we could also just be having, once a week, we could just make food and hand it out. There's just, you can use all of these tools for sort of more traditional library. Oops, my office thinks that I'm not here. More traditional library programs, but they can be adapted for special use. And through me talking about this like a crazy person and being so excited about it and telling everybody I know, I mean, this is kind of serendipity, but I was connected with a private donor who was so excited about this, and in particular about the fact that I was going to have an all-gender bathroom. That was huge. And this person ended up donating several $millions to this campaign. So being an advocate for your programs to anybody who will listen to you, that is huge, because you never know when you're going to meet up with somebody who has resources, or that people get to know you in the funding sphere, and then they're like, we have a donor who that matches with your yeah, I need someone that, yeah, well, I still need one other. So I guess it's just always building on what you've done and never stop talking about it so that you bring it to the next level. And I insist on being on all the tables. I went out to, the police and to the regional policy board on homelessness prevention and to behavioral health people. And like, I'm at the library. I want to help. I want to get on your board. I want to, who can I partner with? Can we get into is there any grants available that would you could apply for that I could be the facility for or something like that? So it's never just me deciding what I want to do. It's talking to the organizations, talking to the people. What are your constituents need that I can help you with? Because I have the structure, I have the staff, I have lots of resources. And then, we can write this grant together and I can be part of it. So I'm sorry, I just kind of went off, but is there anything specific that?
No, I mean, Antonia, this is why I asked you to do this. You're such a wonderful example of, we talk about libraries being for the people, and I really feel like you take that to this like next level of being loud for the people, being the voice for the people, and like really advocating for your library to represent that. And it takes work. We were talking about this before we opened up the room about like the hustle. Like it is a hustle, and you're talking about like I'm trying to have a seat at every table, but what you're showing is like this building blocks of a network. So like even with like your grants, and I always say this to people, when you're doing a grant, don't try and just think of it as this like one-off project, or don't even think of it as transactional. It's very relationship building, especially with when you're working with special populations. And like when Lindsay was talking about, when libraries maybe get too hyper focused on like the numbers, like how many people attended said event, actually that value of new relationships and partnerships, you can't really put that into a number, but how important that is and how many doors that can maybe open. In your case, it could open doors to millions of dollars of funding. And I think it takes time to recognize that because it is a slow burn, right? It's not something that's going to happen overnight. So thank you for that. I think you give a really great picture of what that can look like.
I just want to add one thing too, is depending on what it is that you feel your community really needs. I know that mission drift is often a concern for people, but you can always tie these things back to literacy. Okay, so it's like, it's almost like a wellness literacy. And then if somebody says, oh, that doesn't make it, you can always hold up a book because you have one, right? And you can always do things that are more traditionally literacy connected to make a fuller program. But what I was wanting to get at is that sometimes you're going to do these things and you don't know yourself. You don't have the personal experience. You're not a person with lived experience. And so you're going to have a steep learning curve. And that's something that I'm doing right now. And I know that Maureen Coleman is on this presentation. And I have been like, I'm interested in helping with harm reduction. And so I've been sort of like putting myself, going to conferences, showing up at events and saying, I have no idea what this is about, but I think it's really important that my library is in this space and supporting other organizations. So tell me everything and I'll just keep showing up. And now granted, I'm the director, so I can kind of make these decisions on my own. And I'm also a private nonprofit. I'm association library. So I don't have to like tell the town. So that, in some ways that makes it easier for me because I have more flexibility in what I would like to be doing. But funding wise, I have to get all my money by myself. So yeah. So don't be afraid to be brave. If it's something that you feel and you have reached out to your community and you know that it's lacking, find people around you who also know what's going on and then make the commitment, learn about it. So then you can talk about it. And the libraries are trusted. So you validate, and even though that's weird, you validate a lot of things that might be kind of controversial or innovative because people trust the library and they know that you're going to do, the best job at it. So that's kind of where I'm at.
No, thank you for that. We only have a couple of minutes, so I will open it up to questions. I'm going to bring Lindsay back here. And while we're waiting for questions, feel free to unmute yourself or just throw them in the chat. And Antonia mentioned Maureen Coleman. Maureen is on here. She's the assistant director at Plymouth. And if you are doing or trying to start some harm reduction resources or support, Maureen, I don't mean to be like Everyone go to
No, I
Maureen.
could talk any moment of any day for too long about getting those sort of initiatives started. So if anybody's interested in any of that kind of stuff, yeah, please reach out and let me know. We created a recovery corner here, so we have like Narcan and Sharps containers and wound care kits and rescue breathing masks and fentanyl testing strips. I think we're also getting xylazine testing strips and other things from one of our community partners. So we talked about community partners being so critical and important. And just echoing Antonia, if it's something you care a lot about, then other people also care about it. You just have to find those people. And I think that's a good starting point for getting initiatives like this started. So yes, if anybody wants to talk about harm reduction in libraries, I'm your girl.
And I'm putting the link in for MLS did like oh my God, an interview with Maureen like a year or two ago about the recovery corner. So I'm just linking that in the chat so you can get a good sense of what that is.
I threw my email in there also.
Okay, thank you. But yeah, a couple minutes. If anybody has a question, please ask.
Oh my God, we covered it all. That's amazing.
Solved the world problems today. All right, if there's no questions, always reach out to any of us. I'll even throw my email in, just like Maureen can talk about recovery corners all day. I can talk about prison outreach all day. So I feel like we all have our like little corners of random expertise. Oh, here's a question. So from Medford, we often have community members or partners reach out. How do you decide which partnerships to prioritize? That's a great question.
So I'm just going to pretend that I'm an expert and talk about this. I think a lot of it is kind of getting back to like starting to have those initial conversations. Are they coming to you with like an idea that's already there? How big is that idea? What kind of thinking about like when you look at like what are we as an organization and entity prioritizing? Like, Antonia talked about like I could immediately see like who aren't we serving? Is that something that you're looking at? So I think starting to look at those pieces, and it's delicate like partnership where sometimes it's like, oh, these people reach out to us and they're really like visible in the community, but like we actually want to work with these other people. So I think some of it is like what do you guys want to do together? How involved is that? What else do you have going on? And kind of like dipping your toes into something. Like maybe all they want is like, can we just use your space? And that's an easier thing to do than like, we want to partner with you on this grant and it's going to require all of this time and effort. So it's, I don't mean to be like this is, well, you just got to think about it. But some of it is like doing this big picture work and thinking about like, if we commit to this, what can't we do? And how much of a priority is what we want to do together? And those partnerships can like ebb and flow where it's like, oh, it's going to be a small thing now, and then it's going to be a big thing. And it really is just about kind of your entire bandwidth. And you can always like just be talking to people. And then when the time is right, and you can always be like, we're not the people for you, but here's my network and here's what else we can do. So there's no easy answer, but it is kind of like just thinking about what is everything that's involved that seems great, but also kind of like if we're going to do this, we can't do that because I don't know any library that has endless funds and staff. Or you wouldn't be at this or you wouldn't be at this webinar.
It's 3 o'clock, so I'm going to be mindful of everyone's time. And just big thanks to Lindsay and Antonia. This was really a fun conversation. I hope people took things away from this. But again, send questions to us. I will email out the recording. And I think Lindsay has some goodies, aka grant links to grants that she's going to also share. So thank you everyone for being here and have a good rest of the afternoon. Bye.